Hey Mega Ninjas, so what we're going to do is go over the basic plank. Now, we're going to start in a bridge position. So you're going to be laying on your back and try to work on hip extension, get that glute to fire again, okay? The reason why we start here is because honestly, we're going to finish here too. It's that important. So most people don't fire the glutes like they're supposed to, and we'll talk about more of the anterior pelvic tilt and what sitting will do with you, etc. So lay on your back. You're going to have your feet about hip width apart. And all you're going to do is, I want Haley to arch her back. You go back to the ground. You're going to arch your back and then flatten the back. Arch the back, flatten the back. Now I want you to do more of the flattened style for here because I want that spine supported. Because what will happen a lot of times is once people start bridging up, pick your butt up off the ground, they will arch their back and now their back starts hurting. Okay, you can relax. So what I want you to do is start first in a good spinal neutral position and then pick the butt up off the ground. Okay, you don't have to go too high, stay about neutral if you can, nice straight line. Now to get a better glute activation, I want you to bring your toes off the ground. You're going to drive your heels into that ground. Okay, this is step one. Then what I want you to do is, if you feel nice and stable, you're going to straighten one leg up. You're going to keep it in line with the other thigh. So you're not going to bring it really high or anything like that. You're going to try to keep it level. Your gauge to see if this hip is weak is if this hip drops. Okay, so if it looks kind of like this, that's a bad sign. It leads to let you know that you need to work on the down leg. Okay, so bring it back up. Good. You can relax the legs, switch legs. You're going to do 10-15 seconds and switch. So she's doing a really good job. We're going to make this harder in the future, but this is what I want you to get a hang of. Now you're going to do 10-15 seconds, do about 10-15 reps each leg. Okay? Then you're going to roll to your side plank. Good. You can go on the elbow. Now first, what I want you to do is nice straight line, but you're going to do it on your knees. Make sure your chin is down, head is back, nice, beautiful, straight spine. Okay? You don't want that hip to sag down. You don't want to go, honestly, too far up. You just want to not rotate. You want it to be shoulder to shoulder, hip to hip. There again, can you hold it for 15 seconds? And then we'll build up to this one, okay? Now to make it harder, you put the top leg in front and you go to your feet. There again, keep your head in a nice neutral position and make sure that line, that plumb line is nice and straight, okay? Then what I'm gonna have you do is you're gonna just roll. The reason why I have your feet that way is because you can roll straight into a plank. Now, the main thing with this one, there again to harp on it, is are you nice and straight? Okay, because a lot of times you'll drop the head down, go ahead and drop it down, that's a no-no. So you bring the head up, chin dead down, there you go. And you wanna make sure you don't have an arch here in the back. Go ahead and let the bad thing happen. There you go. No, this will jam up all that facet joints and cause tons of lower back pain. Okay? So to help with this, if you can't maintain this, go to your knees. Because sometimes your hip flexors are so tight, it pulls that pelvis forward and you can't keep it. So what I'm gonna have you do, hands and knees are hip width apart. And you know that machine you get on the gym, you kind of hold the handles and you sit down and you just sit there and kind of work those bad boys. Pretend you're going to do that. So you're gonna try to drive the elbow and the knee together, okay? So when you do that, push, you should feel a lot of stress here. Now go ahead and arch. I don't want that, okay? Go ahead and go back to neutral. You want a neutral spine, but you just wanna make it nice and stiff, okay? So if I push here, her stability is right here in that lumbar spine because this is designed to stop extension. A plank is an anti-extension move. So if you actually get extension, you're not holding the position correctly, okay? Now, the whole drill of this is to see if you can maintain this position, and then what I'm gonna have Haley do is straighten one leg. I don't want this to change. Go ahead and bring your leg up a little bit more, and then this will happen. So she is getting hip extension in theory, but causing her lumbar spine to extend. You can relax for a second. So the whole point is, can your spine stay stable when you move your extremity, take that back down, or push your arm over your head? That didn't change either. That is our goal, this right here. Okay, have fun with that. Take it nice and slow, and just focus on this movement. What's up guys? So it's time for some micro breaks. What does that mean? I know you sit at work all day. Don't lie, you don't get up and take your breaks. So what can make you stop your day to get up and stretch and get mobile so you're not in that gross hunched over position? Drink your water. You're actually supposed to drink half your body weight in ounces of water every day. So guess what? You're going to be using the bathroom quite a bit. So there, you let your body tell you when to take your break instead of you having to set an alarm and then you're like, oh, I'm working, I'm not going to stop. Okay? So what areas are we going to focus on for your stretches? Now remember, in this little poster right here, it's going to show you what areas we want. What areas need to be mobile, what areas need to be stable. So we're going to tackle the mobile areas. First one we're going to do is we're going to start at the top, work our way down. So we need to get this upper neck to move. So I want you to do the fun chin tucks. So it's the gross little double chin, super flattering, lovely. But what you do is you just kind of tilt that head. I like to push my fingers at the base of my skull and sit there and kind of traction that head down. Okay? If you need a little extra assistance, push, relax, you can take your thumb, put it underneath your chin, nice straight spine, get to that end motion and kind of push into it, then relax, see if you can go a little bit further. Push again, relax, go a little bit further. Get that motion in that occipital atlas area. Okay? Now we're going to work on rotation. Rotate. There again, I like to push, relax. Put your hand here, lightly push your head into your hand, relax, see if you can go a little bit further. Do it again, relax, go a little bit further. Now I don't want chin up. Chin is down. Almost have a nice little pretty line right here when you do it. So don't think that you got my eyeball going over your shoulder that you're getting extra range of motion. You're not, okay? So you need to do that on both sides. Next is the door stretch. We want to open up that pecs, front chest, shoulder area. So there again, we need this to open up. Find a door frame, come up. Put your hands here, you can put your elbows there if you're wide enough. All you're going to do is chin down, head back, spine nice and stable, and lean through the door, okay? Not letting the back arch, not dropping the head super far, nice and stable. You should feel the stretch all through here. You can go higher if you want to get a different angle. You can go a little bit lower just to get different fibers hit in the chest, okay? Just hold it for about 10-15 seconds and work on your breathing. Okay, the next is the toe touch. It's kind of important to be able to touch your toes. If not, you shouldn't be deadlifting, you should fix that. So, feet together, lock the knees out, and can you bend and just touch the toes? Now, a lot of people will kind of shift a little bit funny, will kind of want to bend their knees. That's not our goal for right now. I actually just want some spinal flexion. You shouldn't blow out your back just bending over to touch your toes. Now, I'm not trying to tell you to pick up heavy weight with a rounded spine. We're just trying to make sure you have that mobility. So what you do is you just go down. I actually want you to look your eyeballs, try to see if you can go between your legs, okay? That way you're not doing an extension when the rest of your spine should be flexed, okay? Now if you can't achieve this, what you do is you go here, say if that's all I got, then you can either lock the knees out, kind of flex the quads, and see if you can go down. So what's happening is you're contracting one area to relax the other one if you have tight hamstrings, or say if it's a pelvic dysfunction issue and it's just not stable, one thing you could do is squeeze the knees together and then relax, see if you can go down, okay? So see if you can do 10 toe touches for that break. Next is the hip flexor. So if you're sitting all day, this thing is gonna get super tight. This thing is tight when you stand up, that pelvis is gonna go forward, it's gonna arch the lower back, it's hard to activate the core, hard to get the glutes to fire, because this thing is super locked up. How you're going to do it, easy one, is you can grab the leg, bring that knee to knee, okay? That's step one. Then I want to see if you can engage the core and then try to bring that knee back. You're not arching the back, you're keeping your core engaged and then bringing the knee back, okay? Hold that for a good 10-15 seconds. Have fun with that one. Last but not least, for the areas that need to be mobile, is the ankle joint. And honestly, the big toe. We'll kind of combine the two together. So what you're gonna do, you can do just a basic calf stretch. Lock that knee out, try to increase the ankle flexion, it's called dorsiflexion, in that ankle joint. There again, you might feel it a little bit higher up. That's more of the gastroc, and this is more detailed than you probably want to know. Then you bring your foot in, and then you start to drop down, okay? This hurts the knee. Be careful with this one if you have some patellar tendonitis. It'll kind of ache a little bit, but doesn't mean that muscle still doesn't need to be stretched, okay? So start off with the big one, the gastroc, the big meaty muscle of the calf, and then bring it in and just drop the body weight down, okay? How to gauge to see if you need this. Find something that's a good fist width apart, technically supposed to be 5 inches, and can I sit there and can I touch my knee to whatever that angle is, in this case a corner of a wall, without my heel coming off the ground. So if I'm going and I get about a few inches, that's all I got, that's bad news. You definitely need to either work on that calf muscle or there's something blocking it in the front. We'll take care of that.